The next area after didactic music therapy is the medical area of music therapy practice. So the medical area focuses on the meeting of the broad spectrum of therapeutic needs of clients with an acute or chronic medical condition, as they occur at any time during the course of their illness, treatment, or recovery. This includes all applications of music and music therapy that provide direct treatment of the medical condition and its symptoms, various kinds of supports that may be needed during medical tests, surgery, or procedures, and therapeutic processes that address the emotional, interpersonal, social, spiritual, and ecological needs of the client and the family. Examples of the medical area of music therapy practice include music therapy in medicine, medical music therapy, rehabilitative music therapy, neurologic music therapy, and palliative music therapy. So in music therapy in medicine, the music therapist uses music experiences within a supportive client-therapist relationship to provide the patients with immediate relief of symptoms of an illness or reactions to a medical procedure. This may be accomplished through direct intervention and through adjustment of the psychological or physical environment. The practice may take place before, during, or after surgery or other medical procedures and during brief stays in intensive or hospice care. In medical music therapy, the music experiences and the relationships formed through them are used to address significant needs of the medical patient over an extended use of time. That is, this is beyond a single short-term procedure or hospital stay. This may involve working with the patient in a variety of settings, such as the hospital, a clinic, at home, in a hospice, or in private practice, with the length of treatment varying according to the nature of the medical condition and the client's needs in relation to this medical condition. Rehabilitative music therapy is the use of music experiences and the relationships that develop through them as a means of helping clients who have been debilitated by illness, injury, or trauma to regain previous levels of functioning or adjustment to the extent possible. Neurological music therapy, or NMT, was developed and defined by a man called Taut. And this was developed as the therapeutic application of music to cognitive, sensory, and motor function challenges arising from neurological disease of the human nervous system. Its treatment techniques are based on the scientific knowledge of music perception and production, and their effects on the non-musical brain and behavior functions. Populations served by neurologic music therapy include, but are not limited to, stroke patients, people with traumatic brain injury, Parkinson's or Huntington's disease, cerebral palsy, people living with Alzheimer's disease or dementia, people with autism, or neurological diseases and disorders affecting cognition, movement, and communication, such as multiple sclerosis and muscular dystrophy. In palliative music therapy, the therapist and client work together, using music experiences and resulting musical relationships to help the clients and their families to examine and work through the issues that arise during the final stages of the dying process, and as a means for helping the client to gain a sense of closure and meaning.